Hello, this is the respiratory system lecture. This is part 2 of the notes, the clinical correlations part, starting on page 68 of your notes outline. At the bottom of that page where it says respiratory infections. Respiratory infections are caused by microorganisms that are either located in the upper respiratory tract or the lower respiratory tract. So we're going to divide the respiratory tract into the upper portion, which is located above the trachea. That would include the nasal cavity, the pharynx, and the larynx. And those parts that are located below the trachea would be the lower respiratory tract, and that would be the bronchi, the lungs, and then the alveoli. Okay, so we're going to talk about those in terms of upper or lower respiratory tract, and be sure you label them in your notes that way as well. Two best ways to prevent infections overall, especially respiratory infections. Wash your hands. Remember, sing the happy birthday song twice. That's what we learned from the COVID pandemic. Also, get vaccinated. That's the second most important way to prevent infections. There are many vaccines against respiratory infections, including flu vaccine, which is offered every year, pneumonia vaccine, which is offered for older people right now, I think 60 years and older. There's a vaccine against tuberculosis, and there's a vaccine against whooping cough. Most of you have had those already. And there's also, as we know, a COVID vaccine as well. The cold is known as rhinitis, an infection in the nose, nasal passages, and sinuses. This is an upper respiratory tract infection, and it has a viral cause. It's caused by the cold virus, which actually is a coronavirus. There are over 200 different versions of the cold virus. This is one reason scientists can't make one vaccination against the cold virus, and it continues to mutate. So there's never been a vaccination to help prevent the cold. When you get a cold, it lasts 1 to 2 weeks, and treatment for a cold is over-the-counter medications and rest. The flu, also known as influenza, is an infection of the lower respiratory tract and the bronchi. It is a viral infection. It's caused by the influenza virus. There's 3 major types of influenza virus, and the treatment for the flu, again, is over-the-counter medications. It is preventable with a flu vaccine. Flu vaccine is available against 2 strains, H5N1 and H1N1. Every year, the WHO, World Health Organization, and CDC determine what the most prevalent version of the flu virus will be that year across the world, and they make a vaccination that's going to knock out most of the flu that's going to be circulating the world that particular year. Okay, we have strep throat. It's an infection in the pharynx. It's a bacterial infection, upper respiratory tract then, right? So it's a bacterial infection caused by a Streptococcus bacteria. Symptoms are very sore throat, accompanied by swollen glands and fever. And you can see from these pictures, you get some interesting looking either red spots in the back of your throat, and you can see how the back of the throat is extremely inflamed and swollen there. Or you're going to get these white plaques in the back of your throat on your tonsils. If strep throat's untreated, there can be serious consequences like rheumatic fever, kidney disease. So that's why if you have a strep throat or you think you have strep throat, go to the doctor, get a strep test. It's a rapid test. You'll get the results. The doctor will prescribe antibiotics, which usually will get rid of the Streptococcus bacteria pretty quickly. A disease of the lower respiratory tract is pneumonia. It's an infection of the lungs. Pneumonia means rattling. That's what you hear when you listen to the lungs with a stethoscope. So the lungs are inflamed. There's a thick mucus buildup. Pus accumulates in the alveoli. So that means there's difficulties in gas exchange at the level of the alveoli. The bronchioles are inflamed, swollen, constricted. Causes of pneumonia are either viral or bacterial. Trauma can cause pneumonia as well. If pneumonia is not treated or cared for, the lungs can be scarred and permanently damaged. The microbe that causes pneumonia, again, that is either viral or bacterial. The viral microbe is the influenza virus, or the bacterial microbe is pneumococcus bacteria. Tuberculosis is an infection of the lower respiratory tract. It causes a chronic infection in the lungs. It's very hard to get rid of. TB bacteria may have a dormancy period of months to years in your lung. And so they resurface, they cause more infection, and then they'll kind of go into hiding. The microbe that causes this is the bacteria Mycobacterium tuberculosis. It's transmitted through respiratory droplets, and it results in fibrous tissue buildup in the lungs. This can be fatal if not treated. It's diagnosed by a TB skin test. Also, TB blood tests are available. A positive TB skin test or TB blood test means that a person has been infected with TB. This does not indicate if the TB infection is current or past. So a chest x-ray will then be done, as well as a sputum, spit, in other words, culture, looking for active disease. You would culture your spit. The microbiologist will culture your spit and see if there's live tuberculosis bacterium in that. Treatment. There's a multi-drug cocktail to treat tuberculosis. And unfortunately, multi-drug resistant strains are on the rise. All right, now let's talk a little bit about other respiratory problems. And these problems that I'm discussing now, there's not a cure for any of them. The first one is a lower respiratory tract disease called asthma. Asthma is triggered by allergens, and it creates inflammation in the bronchial tubes and increased production of mucus in the tubes. The bronchial tubes also spasm. That's when the airways tighten or fill with mucus. Symptoms of asthma: coughing, wheezing, shortness of breath, chest tightness, pain, and pressure. Asthma can be treated with bronchodilators. So those are used to open up the airways. They contain steroids, which reduces the inflammation. Next up, we have bronchitis, a lower respiratory tract infection, which is inflammation of the bronchial tubes. This can be caused by viruses or bacteria or some kind of chemical irritation, like smoke. The result is an inflammation of the bronchi and production of excess mucus. This triggers a deep cough. Symptoms can be slowed down if by over-the-counter medications or an inhaler. Damage can be reversed from bronchitis early on if it's caused by smoking, if the person stops smoking. Emphysema is a disease that affects the alveoli of the lower respiratory tract. It's a chronic degenerative disease causing breakdown of alveoli walls. What happens then, especially you can see this in this picture with the damaged alveoli. Once that happens, there's a decreased surface area for gas exchange. That means less oxygen is leaving the lung and getting into the blood to go to the tissues. The alveoli lose elasticity. People have trouble exhaling. Emphysema can be caused by a variety of conditions: viruses, bacteria, or chemical irritation. What will slow the symptoms? Over-the-counter meds and an inhaler. Can damage be reversed? No. Once the alveoli are damaged and they look like this condition cannot be reversed. COPD stands for chronic obstructive pulmonary disease. It's a combination really of two diseases of the lower respiratory tract, a combination of bronchitis and emphysema. The airways are obstructed, so all of the symptoms that go along with that, you have low oxygen levels in the blood, can't exhale fully to get rid of carbon dioxide, so you become a little bit acidic. Your blood will become acidic. Long-term effect is scar tissue in the lungs and decreased number of functional alveoli. The patient will have to be eventually put on oxygen. Smoking is the most common cause of both COPD and emphysema. Lung cancer. Lung cancer is the most common cancer in males. the second most common cancer in females. Most deaths overall are caused by this type of cancer. But 85 to 90% of the cases of lung cancer are caused by smoking. Guess what? That means they are preventable. Non-smoker causes can be radon, asbestos, and secondhand smoke. Typical progression of lung cancer, chronic inflammation of the lungs, changes in the cells to cancerous cells, uncontrolled cell division to form a tumor, then the cancer cells will metastasize and spread to the rest of the lung and other parts of the body. Okay, I have some questions for you guys. Please look back in your notes as you answer these so you get them correct. Some important concepts for you to be aware of as you're studying your notes for the respiratory system. First of all, read chapter 14. What's the function of the respiratory system? What's the location and function of all the parts of the respiratory system? So be able to outline from the minute the air enters your nasal cavity, where does it go from there? What are the parts of the nasal cavity and their functions? What are the parts of the larynx and their functions? What cell types line the trachea and what are their functions? Be able to discuss how smoking affects the trachea. Where does the exchange of gases occur in the lungs? What cavity contains the lungs? What controls the rate of breathing? And what can you tell me about the mechanics of breathing? How is oxygen carried in the blood? How is carbon dioxide carried in the blood? But you don't need to know the chemical equations for the bicarbonate buffer system. What is the diaphragm and the intercostal muscles and what are their functions? All right, guys, thanks, and I'll see you in class.